Welcome to our Empath Honors briefing. We'll be getting started in just a few moments. Thank you so much for being here. For those of you on the call today, if you could take a moment to share in the chat box your name, the organization that you work with, if you're joining from a service organization. If you are someone who has served in the military and are comfortable sharing your branch and era of service, we would love for you to share that as well. Thank you. Welcome to our Empath Honors briefing. We'll get started in just over a minute. And for those who may have just joined, just wrote in the chat, we would love for you to share your name. If you're joining us from a service organization, if you could share what organization you are joining from. And if you are a military veteran or active service, if you are willing to share your branch and the era of service. Thank you so much for being here. So someone let me know that the chat wasn't working for them. So I'm going to look at that in the background. If you're having difficulty using the chat, I'll see if I can determine if there's an issue for those of you joining as attendees. But thank you again for being here, and we're going to go ahead and get started with our program.
Great. Thank you, Melissa. And thank you to everybody who has taken time out of their day to join us today. To the veterans on the call, thank you for your service. And to our panel of experts from the VA, Dementia Care and Cure Initiative, and the Alzheimer's Association, thank you so much for joining to share what it is that you do for the community to advance support for caregivers of those caring for a loved one with Alzheimer's or dementia. So the reason for our presentation today is, if you can see the screen, the fact sheet here is, unfortunately, you know, Alzheimer's and dementia diagnoses are continuing to climb. Oh, there we go. So nearly 500,000 American veterans have Alzheimer's, and the population, as the population ages, that number is expected to grow. For a veteran population, the prevalence may grow faster than the general community just because of some risk factors, oftentimes due to service. So evidence indicates that moderate and severe TBI or traumatic brain injury can increase the risk of developing certain forms of dementia. And PTSD has been linked to an increase in dementia as well. So it was important for us as a leader in the community of connecting people to resources and services to shine a light on some of the resources that are available through community partners and the VA, so that veterans themselves and their caregivers can have better access and understanding of some of the support that's out there. So we have a jam-packed hour. We may run over a little just because there is a lot of information to get through today, but we are recording the seminar. So if you do have to jump off and want to revisit the recording, you would do that through our empath health.org/briefing link, and all of the recordings are documented there on the right-hand side of the web page. So without further ado, I wanted to introduce Deanne and Jody with the Alzheimer's Association. They are going to lead us off today and share some of the great work that the Alzheimer's Association is doing for our community. So welcome, Deanne and Jody. If you want to take just a minute to introduce yourselves, and then we'll jump into those slides.
That'll be great. So I'll introduce myself and then pass it to Jody, which we said you'll see kind of a volley between the two of us for our PowerPoint. So I'm Deanne. I am the Health System Director for the state of Florida with the Alzheimer's Association. Grateful to be here. You know, it is a top priority for us within health systems as well as the VA to provide the support and resources, because we know not every veteran has the privilege of using all of the resources. So how do we become a guide and conduit to giving them the best support through their journey, whether it's aging or with a diagnosis of Alzheimer's and dementia? So we'll be sharing a little bit more in a moment, but I'd like to pass it off to Jody to introduce herself.
Hi, everyone. My name is Jody. I am one of the program managers with the Florida Gulf Coast chapter of the Alzheimer's Association. So happy to be here today to provide the veterans some great information that we have. Deanne, I'm going to kick it back over to you to start the presentation.
Thank you. So this is an opportunity to share with you, our work is about people and science. And we like to share our emblem here, which shows, the first part of our people is the brain, and then the beaker being science. We are an organization that supports not only care and support, public policy, as well as research. And so it's really important for you all to know that we have multiple pillars within our organization, really striving to make a world without Alzheimer's and other related dementias. Next slide. I wanted to share our facts and figures. So a couple things to share with you all is that this is public information. And I want you to feel that you can pull the information that we have here through our website, which we'll put some links in a few minutes that you can use. We update our facts and figures on an annual basis. So every year around February, March, you will see where it says 2022, next year in 2023. So if you use any of our information to go back and make sure you're citing new data and new information. A couple things that really stand out that you'll see here is 1 in 3 seniors with Alzheimer's or other dementias will die from this disease. It is affecting more than 6 million people in the US today, with it projected by 2050 to double to more than 12 million. The new special report that came out, you'll see in the top right-hand corner, more than 80% of Americans know little or are not familiar with mild cognitive impairment. We know that that doesn't necessarily lead into Alzheimer's disease. You can live for much of the duration in MCI, but that we do know that the impact does start with early detection, and early detection around care planning and support, and also for the support for the caregivers. And then another thing that is important to share with you is that our numbers for this disease, which I think you can go to the next slide. Okay, it's not there. For the state of Florida. So I mentioned 6 million in the US. Here in the state of Florida, we have more than 580,000 people living with a diagnosis, with it expected to grow by 2025 to more than 720 identified diagnosis, right? So keyword, identified. The work I do in health systems is around helping to support health systems in timely detection and accurate diagnosis. And then for the community to be better advocates for themselves, to really, be advocating at those visits if you see changes in memory and thinking. A lot of this work is driven today by consumers, whether it's working at the VA or working with a local provider. Driving that through caregivers and the person that could suspect is really critical. So with that, I'm going to take a pause and ask Jody to take the next slide after this. So talking about resources and support in your community.
Absolutely. So as a program manager, we provide care and support to the communities across Florida. The Alzheimer's Association resources, and we have a great many of them, they provide and enhance care and support for all of those facing the disease. And we offer the following resources. We have a 24/7 helpline, and the number is the 800-272-3900 number. That literally is 24/7. It's 21 different languages, and it's manned by master's level clinicians that answer the phone calls. We also have what we call allsconnected.org. And then we have the ALS Navigator as well. And then we have a variety of in-person support groups and educations. And Deanne's going to go through that in a little while. You can find those on our community resource finder on the alls.org website. The next slide, please. So our statewide network of support. We have a support group just when you need it. So we have in-person support groups, we have telephonic support groups, and we also have virtual support groups. These groups happen all throughout the day, all times of the day. When you need one, we have one available. We also have a variety of the support groups. We have what we call family caregiver support groups. We also have early stage support groups and specialty support groups for our Spanish speaking gentlemen, the LGBTQ caregivers, and most recently for our younger onset. Younger onset is anyone under the age of 60 that has been diagnosed with Alzheimer's or dementia. We also have a programs on our allsprogramsanytime.org as well, where you can join webinars. You can look at the programs that we currently have on there. We have effective communication, understanding Alzheimer's and dementia, and those you can sign up for. They're all virtual. And you can just go to the allsprogramsanytime.org to pick which program you would like to watch or which webinar and sign up for it. You'll get a link sent to your email, and you can click on the link and you can watch it at your convenience. Deanne, I'm going to send it back over to you.
I think you're staying
Oh,
with
wait, I think it is me. One more time. Sorry about that. I lost track and count of the slides, everybody. So community education. We knew this was going to happen. Community education. We have free. Everything that we do online and in person is free education. Online in-person education sessions for those living with dementia and their caregivers. So we have programs for understand the 10 warning signs to Alzheimer's and dementia. Also understanding Alzheimer's and dementia. So with that, dementia is the umbrella, and the spines of the umbrella are all the different types of dementia. Alzheimer's is the most common type of dementia. We also have programs on dementia conversations, effective communication strategies, money matters, And then understanding and responding to dementia-related behaviors. With all the different types of dementia that there are out there are many different types of behaviors that happen during the different stages of Alzheimer's and dementia. And we want to make sure that everybody understands how to respond to those behaviors appropriately. So now I think it's Deanne's turn.
Thank you. So the Community Resource Finder, I think, you know, from what Jody has shared with some of the resources we have, we also want to make sure that when we're casting the net, we cast the net wide. And this partnership with the Community Resource Finder is actually in partnership with AARP. And one of the areas that we drive to receive information, or where are the local support groups, is just that, which is the Community Resource Finder. So as you can see here, if you go to the communityresourcefinder.org, it's going to look just like this. You'll have the Alzheimer's Association where you can look for programs and events. And then of course with AARP, Care at Home, all of these. One thing that's really important to share with our community partners on this call is that you have the ability to become a part of the Community Resource Finder if you are not there. So, you know, we can provide you with tools on how to be, you know, go on and register to get your organization found here. And let me tell you why that's critical. Our team, so we're a national organization that works on a local level. What that means is that we drive a lot of that through our national umbrella, that if we determine that there's localized needs that need to happen, a direct connection to somebody like Jody, who is one of our local program managers, will receive that. However, we don't want to miss a beat in those resources. And so when you use the Community Resource Finder, it's going to help you look for education programs, support groups. It could also help you to access if you're looking for hospice or palliative care. So, you know, for an organization like Empath, that's a good opportunity for you to be on the Community Resource Finder. We at the Alzheimer's Association, whether it's Jody or like she mentioned, our helpline, which we'll talk about in a few more slides, is that our team also uses it. They look at it from a local level, finding the zip code where that person lives, and then giving them the resources and tools and what we kind of consider some solutions to identifying the needs locally. Next slide. So 24/7 helpline, it's the slide right after. So let me keep going with the 24/7 helpline. Jody mentioned earlier that it is 24/7, and she said it is just that, and it is. It is 24/7. A couple things to note as it relates to the helpline. It is master's level dementia care practitioners answering these calls. Our staff is trained to support wherever they're calling from. So if they're in Florida, if they're in California, wherever they may be. We also are bilingual. So we have staff that is bilingual, as well as the ability to translate more than 200 languages. So I think that's really important for you all to know. The other piece that I really like to talk about, and I'll share a brief story, is that the helpline isn't just around, I'm concerned that I may have changes in my memory and thinking, I need to figure out how to get a diagnosis. Where we see a lot of this, the support to the helpline is somebody dealing with a difficult behavior, maybe a sundowner condition in the middle of the night that they can call, and those master's level clinicians will help to de-escalate, give resources and tools. And they may make a recommendation to that loved one to participate in those dementia-related behavior educations or even effective communication. What we know as caregivers is that we have to change our behavior. The course of this disease for the person living with dementia, they cannot change their behavior. And it's really helping to support that. The story I like to share here is I was in Chicago a couple years ago, pre-COVID, and met one of the here I sit in that work, the helpline representatives. And I said, I'm a storyteller. Do you have a story for me? And she said, oh, I do. And she worked at night. She was just getting off at 9 o'clock. I was at the coffee machine, by the way, hence why she was there. And she said, I got a call at about 2 o'clock last night from a woman who had just placed her husband in long-term care 2 weeks before. He tended to be a nighttime wanderer, and she woke up, looked for him because he was no longer in the bed and realized he was not home anymore. And it really caused some, not only anxiety, but sadness. And somebody had told her about our resource. So she called and she got this master's level therapeutic conversation for an hour and a half. So friends had been telling her, you should be sleeping better. Now we can go out to lunch. But we know in this journey, her grieving has changed. Her grieving to the person, her loved one, her husband, having a diagnosis, seeing the changes, then now grieving the loss and the caregiving changing exponentially when you place somebody in long-term care. That becomes sometimes more stress and burdensome for the caregiver. And she just received validation. So whether you need resources, whether you need de-escalation in behaviors, or you just need a therapeutic, objective person to listen to you, we're there. And it's at no charge. So if I could encourage any of you, this number you see here, because even for myself, 6 months, a year in, I'm like, what is that number? I had to keep memorizing it. I encourage you to put it in your cell phone. You could be standing in a line with somebody at the grocery store that this number could impact them. So please write down the 272-3900 with 800 in the beginning. Jody, I'm going to pass it to you now.
All right. So in the state of Florida, we want everyone to become an ALS star. So we know that there's 580,000 people living in our state that have Alzheimer's and dementia. That comes to about 1 in every 37 Floridians is going to be diagnosed. That number is going to grow exponentially. They expect it to over the next several years. And I believe it's by 2025, Diane or Denise, they expect it to be 720,000 people living with Alzheimer's and dementia. So this is one of my favorite programs. So this is the ALS Star. We want to encourage you to become an ALS Star. The Florida Department of Elder Affairs and the Alzheimer's Association partnered together to create this absolutely phenomenal program and joint initiative to increase the awareness of dementia and all the resources that are available. It's a very short program. It takes about 35 to 40 minutes. You will identify the warning signs to Alzheimer's and dementia, identify the 10 warning signs to Alzheimer's and dementia. You're also going to learn how to take the steps to receive an accurate diagnosis. And you're going to understand some simple communication tips and techniques in talking with somebody who does have Alzheimer's or dementia or does have some of the warning signs. And also, you will have access to additional resources as well. You get an official completion certificate that you can do whatever it is you wish with. Mine is hanging on the wall. And you also can register for the program free of charge. It is an absolutely wonderful, wonderful program. I can't say enough about it. You go online to allstars.org, register your name and your email address. They send you a link. You click on the link and up comes the program. And at the end of the program, you have a short little quiz that you have to take on everything that you have learned. And then after you complete the quiz, you get your completion certificate.
So before you pass on, because I know Jody's going to volley back over to me, a little tidbit you'll see at the bottom, Dementia Care and Cure Initiative. So Salisa, who's on the call, who's going to speak after us, she is one of those stars on the video for the local area for Pinellas and Pasco. So you'll see her face on there as well. And it is a partnership for the Dcci with the area agency and the Department of Elder Affairs. You know, this disease is a disease of the community, and it is us coming together as one to support what we're doing. And so that to me is so critical, that we are thinking in like minds together. And then the All Stars is for everyone. And it really is, to like Jody's point, it is around concern and awareness. You know, somebody that takes this could be somebody suspected of changes. They themselves recognize it and go, I need to talk to my doctor. So again, it's really a truly concern and awareness campaign. Great explanation, Jody. And
It truly is. I hate to interrupt you, but storyteller that you are, there was someone who actually took the All-Stars and said, listen, I have a problem, and made an appointment with their doctor. And is now going through a set of neurology appointments and things like that. So yes, this program is a phenomenal program. So I urge everyone out there, please become an Alls Star.
yes, for sure. Next slide, please. Okay, so while we talked about All Stars and that being something that you can receive a certificate, we now are going to talk about a training opportunity. So I appreciate you sharing that the Empath team has taken that, but let's take it one step further and show you that we have, again, through the partnership with the state. So Essentials is a program through the Alzheimer's Association that is evidence-based. It is evidence-based for the use of direct patient care in the long-term care setting to include ALFs, skilled nursing facilities, home health, home care, and hospice. And many of those, so I am not as great at sharing this, so Jody may chime in too, but it does cover the state requirements for education. So I would say, beef up for your team with Empath that did All Stars, and let's identify those that are doing that direct care in the home and even pilot some opportunities there. What we have found is, and I'll use a quote from somebody recently, that while the education can seem for some in this field basic, it is basic knowledge that they don't always get in their training. So only about an hour is covered in like nursing and even for physicians and PTOT around dementia. This is going to give you that education around understanding the disease as well as effective communication. It will also warrant not only the requirement, but the ability to receive those CEs, because who isn't looking for CEs? So again, here you'll see the recognition for knowledge of quality care practice through the Essentials. This has been a gift from the state with the Department of Elder Affairs. We've had multiple Project Vitals through COVID, and this was something that they have gifted at no charge. This program generally costs $69 per person, and for the next 2 years is being offered at no charge. I feel like I'm a commercial. Take advantage today, and take advantage really for the next 2 years. We have many openings for that, and then you'll also see here that Katie Franbrook, who is supporting our community education, would be the provider of support to this. I will put my email in the chat, so if you are interested, you can, put a note to me by email. I would say not in the LinkedIn chat or the Teams chat. Zoom. We're on Zoom today, so the Zoom chat. Make sure you send me an email, and I'll directly connect you with Katie. With that, I'm going to pass it back over.
We're playing a little volleyball today. So our brain bus, the brain bus is also comes out to most all of the communities statewide. It is basically a statewide outreach that raises awareness about Alzheimer's and related dementia. It addresses the benefits of early detection, early diagnosis, brain health, and risk reduction. We are very fortunate in this state that we actually have 2 brain buses. We have an RV, which you see in the top picture, and then we have a van in the bottom picture, and they travel throughout the state, and they really focus on the underserved and rural communities that may have less direct access to healthcare. a little fun fact is in 2020, following the COVID-19 pandemic, the Alzheimer's Association was able to expand the Brain Bus to include a virtual program component from any computer, tablet, or smartphone. So the programs are also available in English and Spanish. The great thing about the Brain Bus is you get to learn the warning signs. You get to learn 10 ways to love your brain, how to get to the steps to receive an accurate diagnosis. And we also have the advancements in research that are available on the Brain Bus. We're very fortunate with the Alzheimer's Association that we have 2 research champions within the organization that get us that information to help pass out to everyone. So again, the Brain Bus is funded in partnership with the Florida Department of Elder Affairs and the Area Agency of Aging of Pasco-Pinellas. All righty, next slide, please. So now we open it up to questions.
I think what we'll do is actually hold questions just because
Okay.
we have multiple presenters today. So
All right.
I know we're kind of struggling with the chat. I think Melissa had got that rectified,
Yeah,
but
unfortunately, the chat is not working for some reason. I do apologize for that technical difficulty, but if you do have questions, the Q&A function is working. So please do send your questions in and we'll save them towards the end for all of our speakers.
perfect. Thank you. Thank you, ladies. Such a great organization, a lot of great resources that I think many people in the community may not even be aware of the reach and depth that you offer to support people on this tough journey that they're facing with the dementia diagnosis. So thank you so very much. And we're going to jump over to Julie with VA Bay Pines. Julie Borgen is the Caregiver Support Program Manager at our Bay Pines campus. So Julie, if you'd like to lead the way here with how the VA is supporting veterans with dementia.
Yeah, thanks for this opportunity, and I'm hopeful this will be helpful information. So you can go on to the next slide. And so first of all, if a veteran is gonna get care at the VA or any of the resources that I'll go over today, this is gonna be a summary overview, not in depth because of the time factors, but the veteran has to be enrolled in the VA healthcare. And every single VA healthcare facility has an enrollment office, but there's also the ability to enroll online through a form. And so whether you do like any kind of internet search saying VA enrollment, it'll lead you to information on how to submit your enrollment form. But the key team to anything in accessing services, supports, medical resources is through the patient aligned care team. We refer to that as the PACT team, and it is multidisciplinary. The members vary depending on, like, it will always be a medical provider, either a physician or a nurse practitioner. There's different levels of nurses that are on the teams. There's always a social worker that's assigned to the team. There's a pharmacist that is assigned to the team, and maybe some other specialists that are assigned to the team. So that team is the key to accessing all sorts of resources. They coordinate care through collaboration with different programs and specialty areas. They often, especially with the social workers, they'll refer back to community resources such as the Alzheimer's Association for any information that is really key to helping the veteran maximize their health. There is a general website where you can read over information about patient care and primary care. But what is most important is if the veteran wants any family member or close friend who is a support for them to communicate directly with anybody on the PAC team, really should complete what's called a release of information form, or complete a power of attorney to authorize that person to speak on your behalf. That is a legal form, and it's a major decision. But as far as the release of health information form, that can be modified as needed. Every facility also has a release of information office to help you with filling out that form. The providers can receive information, they just would not be able to give out information and do active problem solving with family or friends without that release signed. Next slide. This is going to talk about the different extended care and geriatric services that are available to veterans enrolled in VA healthcare. Every VA has the opportunity to offer home health care, which is home health aides contracted through different community-based healthcare agencies that contract with the VA to provide home care in the home. We have a program called veteran-directed care that is available to some geographic areas, not available to everyone. That is, veteran-directed care is if the veteran meets the eligibility criteria and there is availability, they actually designate a person to provide the care in the home, and then the VA directly pays that person to provide the care. So they have to set up a vendor situation contract with the VA. That's very formal process. VA can also offer respite, which is short-term breaks to veterans and the family members. So the veteran is cared for and supervised by someone else to give the family member a break. We also have access to adult day health care, and that varies. What is offered varies depending on the geographic area. VA also offers palliative and hospice care. They have connection to residential settings, nursing homes. Social workers often, and the nurses also help with advanced care planning to talk about what the veterans want to happen as aging takes place, as healthcare changes, to be part of advanced care planning, and then helping with long-term care planning. There is a generic website which gives overview to all of this, and that's in the slide itself. Go on to the next slide. And then we have the caregiver support programs. We actually have two programs. One is the program of general caregiver support services. One is called the Comprehensive Assistance to Family Caregivers, and I'll share the differences between those two programs. Next slide. These programs are really like an incredible achievement of the VA, because prior to 2008, the concept of family members having any kind of support from the VA just didn't exist. VA was there to provide health care and financial benefits to veterans, and not really to include anything when it came to family members. So in 2008, when George W. Bush was president, there was a lot of work that was going on behind the scenes with different community organizations and the VA to explore the area of needs from family members. And then Congress supported the concept of caregiver support programs being established, and that led to where we are today. So there's been very specific legislation that led to the establishment of the general caregiver program, as well as the comprehensive program. So I'm not going to go into details, but just know what we have today exists because Congress supports all the work that family members do to keep veterans healthy and at home. Next slide. We do have what was created in 2011 was a caregiver support line. It's a national call center. That's actually where I got my start working for the VA, where we have certified and licensed social workers that answer calls to this 800 number. They have specific hours. It is not 24 hours. And if it's appropriate, they'll link the caller back to the local caregiver support team. They can offer information about assistance that's available through the VA. And they also offer supportive counseling to the family members who call, and even veterans that call and are really looking, especially if veterans are dealing with caring for a loved one themselves, and they really just need to talk to someone about what's going on in their life and do maybe even some problem solving. Next slide. So in this, along with the caregiver support line telephone line, there's also a website that has so much information. And so if you are looking for resources from the caregiver perspective, I really encourage you to go to this website, and there's lots of exploring you can do. There's also a site map, which literally outlines everything and all the links that are off this site. So let's say you're looking for anything related to dementia care. On this site map there's a link directly to anything information available on the web about what the VA can offer for dementia care. resources for caregivers are on here. We'll get into the comprehensive program, but the link to the online application is on here. You can find your local caregiver support, staff contacts, phone numbers, all that information is on this website. Next slide. So this is an example, just a small snapshot of what's available on that site map, and I limited it to the information pertinent to today's presentation. So there's links to Alzheimer's information, links to dementia care, not only videos, but just different resources that are out there, information related to Parkinson's disease, PTSD, and caregiving for veterans that are living with stroke survival. Next slide. Now we're going to get into this general overview of the caregiver program. The first one I'm going to talk about is the general caregiver program. This is to serve caregivers that are providing support to veterans in the home or even in any type of assisted living facilities or nursing homes. Next slide. This is a general caregiver. It is for caregivers of veterans who are enrolled in VA healthcare. The veteran might need assistance with activities of daily living. They might need help for supervision or protection because of changes in neurology or other type of physical impairments or injury. The caregivers in this program do not necessarily need to be living with a veteran, nor do they have to be a relative. We have close friends that are part of our general caregiver program that go out and visit the veteran on a daily basis, weekly basis, or really just looking for support on what they can say, not say, any kind of guidance on how to support the veterans in the home. Next slide. We have different support groups available to the caregivers in this program. There's different trainings that take place. We try to focus as much as possible in the trainings on skill developments. So we have particular trainings that go over suicide prevention. We have a training that is virtual that's called Building Better Caregivers. The different modules are focused on self-care for the caregivers, recognizing burnout, taking care of oneself, navigating VA system and maybe some community providers. Then there's also mobile support. We have an anti-caregiver text program, which if the caregiver enrolls, they get motivational texts, or sometimes depending on what level of text program they sign up for, it'll even be reminders for self-care. Did you take your 15-minute break today? Did you make sure to have a meal? Did you make sure to step away? Did you need help and did you ask for it? Those type of text prompts will come through. Then we also do one-on-one coaching with caregivers through different programs we have available. Next slide. Group support happens at Bay Pines. We have right now operating two very specific support groups for caregivers taking care of a veteran with dementia at different levels. We're in the process of expanding the support groups that are offered. As everywhere else, we're coming out of the COVID restrictions and being able to return to in-person groups, but right now we're still offering groups virtually. And then we have different available resources from National Caregiver Support Program that can offer different types of self-care groups virtually. And then we also have a peer support mentoring program where caregivers who are really motivated can be a peer support themselves to mentor other caregivers, or the caregivers that are looking for peer support from another caregiver, they can be part of this program. Next slide. Then we have the program of comprehensive assistance for family caregivers that we refer to as Pcfc. Next slide. This program was specifically authorized by legislation. The first one was back in 2010. We are now under the Mission Act legislation of 2018, which expanded the comprehensive program to open up to veterans who served in all different eras. We are getting ready October 1st. This program will be available to all veterans no matter when they served, as long as they have 70% service connection. And I think that information will be on the next slide. So the eligibility criteria for this comprehensive program, and it's specific. The veteran has to have need of caregiving assistance for a minimum of 6 continuous months. So this is not a program for veterans who might be going for surgery and then going through rehabilitation after surgery and having anticipated full recovery after the surgery is done and the rehabilitation is completed. So this is for veterans who need ongoing care and assistance or supervision and protection. Under the previous legislation, there had to be a connection between the service connection and what the veteran and caregiver were applying for the caregiving needs, but that is no longer required under the Mission Act. So that has been a really significant change. It doesn't matter what illness or injury the veteran is dealing with, living with, it just depends on what level of care there is. Next slide. So in this program, the caregiver gets education and training. They have access to enhanced respite care beyond the eligible respite care that all veterans are eligible for. The caregiver is also eligible for mental health counseling and also beneficiary travel benefits when traveling with the veteran for appointments. What is key for this program is the caregiver that's approved to be with the veteran in this program get what's called a monthly stipend. It's payment based on the general schedule grade 4, step 1. And they get either, depending on the level of which the veteran is approved for, level 1 or level 2, they're either going to get 62.5% of that GS grade 4, step 1, it's so hard to say out loud, or 100% of that amount. So it depends on that. The caregiver is also going to be eligible for CHAMP VA insurance if they don't have other insurance coverage. And then in process, it's been in development with contracts going out to different community agencies. There's going to be financial planning and legal resources available for the primary family caregivers. Next slide. This does require specific application. The easiest way is to go online. The application is going to ask for demographic information, identifying factors, veteran's name, address, Social Security number, date of birth, phone number, and same information for the caregiver. That is all that's asked for. And then we at the program level, we go through all the different steps, but there's different assessments that will take place, communication with the social workers and nurses on the team to get you through all the application process. And this we do within 90 days is the expected time frame for processing applications to the comprehensive program. Typically, we are able to complete that sooner. They can also ask for a paper copy to be mailed to them with a return address, or they can print the form at home off the caregiver website and then mail it to the Health Eligibility Center. We also have our team members at the facility that can answer questions and assist. Next slide. And that is the end for me.
Wonderful. Thank you so much, Julie. A lot of really wonderful information. When I'm out and about in the community, oftentimes what I hear from veterans at our coffee groups is, back in the day, they applied for VA healthcare and for one reason or another, they were denied, or perhaps they haven't even explored if they're eligible. So certainly want to encourage anyone on the call that hasn't dialed into the VA healthcare system for services and support. There is nothing worse than us here at Hospice getting a frantic call from a family member of a veteran who's on hospice services with us, and now they're looking to explore what support and services, and I think everyone can agree with what Julie shared. There's a lot there for the veterans and the caregivers. So it's always better to explore upstream of the crisis or the need, whether you're eligible, and just strongly encourage, if there has been a denial for some reason in the past, situations, circumstances, finances, and diagnoses all change. So there may be some eligibility now versus then. So yeah, thank you so much. A lot of great information, and wanted to introduce Elisa with Dementia Care and Cure Initiative. This is a group that I recently found out about in the county and have been sitting in on some of the meetings, and wanted to afford her the opportunity to shine a light on the great work that this team is doing. So Elisa.
Thanks, Trudy. And thanks so much, Julie, for sharing all that information about the Veterans Affairs for caregivers, especially. I may have you speak to the DCCI task force soon so that we can be able to share all that information with the caregivers that we work with that may not realize all the services that you provide so that they can tap into that. So I am Lisa Bonner. I am the clinic coordinator for the memory disorder clinic that's at Morton Plant that's called Madonna Patak Center for Alzheimer's Research and Memory Disorders Clinic. And I'm the co-chair for the DCCI. We partner with the Area Agency on Aging to provide this service, this education for Pasco and Pinellas County. So you can go to the next slide. So I know Deanne and also Jody shared a lot of statistics, and statistics really speak. Numbers are powerful, and hopefully I'm going to, through my presentation, I'm going to kind of tap into those numbers to give you more of a word picture, because whenever you have a word picture, you can really understand the impact this disease has on our state, our nation, our state, our counties, our cities. And Florida really has the second highest incidence rate of Alzheimer's disease in the nation, only behind California. So Alzheimer's has become a healthcare crisis. In Florida, there's approximately 527,000 caregivers that are providing over 685 million hours of unpaid care, which equals to over $10 billion. You can go to the next slide. And I know this statistic has already been shared, but Florida has over 580,000 known cases of Alzheimer's disease in Florida. That's only Alzheimer's disease. That's not the other related dementias, which there's close to 200 other types of dementia. And also in 2025, which is really not that far away, this number is projected to increase to 720,000 known cases. As Deanne said earlier, these are the only ones we know about. We don't know about, there's some people that don't go get diagnosed, that don't have the early intervention. That's a 24% increase, which that lets us see how much Alzheimer's disease is a healthcare crisis. So since DCCI, we service the Pinellas and Pasco County area for our task force, those numbers specifically of the known cases for Pasco are over 16,000, and for Pinellas County is over 33,000. And that is a Florida Department of Elder Affairs stat from 2021. So of course we know those numbers are higher. So those individual numbers, those combined counties, that would fill each seat in Amalie Arena. I know hockey season's over, so sad. And now we have baseball, and football's coming up, hallelujah, in 2 weeks. But anyway, that would fill each seat in Amalie Arena. This is what it looks like when that stadium is empty. So let's go to the next slide. But we need 2.5 stadiums to seat all those people that have known Alzheimer's disease in our 2 counties. So Amalie Arena holds 20,500 people. Our combined counties have a total of 50,194 known cases of Alzheimer's disease. And like I said, that doesn't include the other types of dementia. So this disease impacts all those who are connected to that one person with Alzheimer's disease. And really to carry this out, and really, I made this slide like during COVID, and just seeing all those people so close kind of gives you the creeps because everybody's so close. But now we've kind of gotten out of that. We've kind of got back into a normal routine. But just to carry this disease impact further, 32,000 of these will wander or become lost on foot or lost in the car at least one time in any phase of their disease process, because they're confused about their location, just confused, period. And so some of those do even wander off more than one time, or they do so repeatedly. So just 32,000, that's going to at least take, 1.5 stadiums of this arena. So this word picture really says it all. Therefore, that's why we need the Dementia Care and Cure Initiative. And you can go to the next slide. So due to the increasing amounts of dementia in our state, in our counties, our cities, that's why DCCI was created. The governor, this is his statewide effort that started in 2015, which is under the Department of Elder Affairs. Really, we want our state just to become more aware and supportive of those living with Alzheimer's disease and related dementias, especially their families and their caregivers. So the vision is it's a community that embraces and empowers people living with dementia, and the mission is to promote dementia awareness through advocacy, education, and collaboration. As Deanne said earlier, we're all in this together. It's not just one agency and one agency trying to do this on their own. No, we all have to work together because there's so much disease around us that we have to work together to better help those that are impacted by it. And let's look at the next slide. So basically our goals for the DCCI is to increase awareness of dementia, its services, its support, to provide assistance to dementia caring communities, and then to continue to advocate for more care and for cure through research programs. So the state of Florida, we really want to lead the nation in this. Well, we need to, since we have our state is second in the nation with this disease, but we really have to start where we live. And most importantly, we need to really look at our own selves individually and what can I change about myself to include and not exclude the dignity and value that somebody is living with this disease process. Also their family members, their neighbors, all these people that are impacted by ADRD. So what can I do? It starts with us individually and how we can change our thought process to make sure we don't shun people living with the disease, but just to include them and engage them, continue to engage them in society. Let's go to the next slide. So I know the whole focus before me with the other talks is just how does this disease impact the individual and also the caregiver? We have all these wonderful resources, but we really have to educate the community and where we live, the individuals that may not be aware of what Alzheimer's disease, what's the difference between Alzheimer's disease and dementia? We get that question every day in our memory clinic. So that's what our focus is for DCCI. Let's educate all the segments of our community. And this, you can see in this picture, is basically the segments. They're kind of broken down with all the different parts of the community. Before COVID, DCCI was trying to focus on just one segment of the community. And that COVID kind of stopped that. And now what we're doing is, with all the task force members, we're trying to, whatever segment in the community wants education and information, we're not going to say, oh, that's not our segment this month or this year. No, we're going to educate anybody that that needs that, because that's going to continue to engage people living with the disease. And recently, actually a couple of weeks ago, the training task force of DCCI, we had dementia-friendly dining training. This was created by a caregiver. His wife has already died, but he knew they always enjoyed going out to eat, but he could see how the disease impacted that wonderful experience they had when dining, and how really restaurants don't embrace that disease process because of the noise and, sometimes the menus are like a book. And so he created this with a friend, the dementia-friendly dining experience. And we're really hoping to bring that into Pinellas County with trying to pilot that with 3 different restaurants or diners in the Clearwater area, so that they can learn how to make sure it's a wonderful dining experience with the atmosphere for someone that's living with dementia. Their staff will be trained, and that, that restaurant's always going to be available to recognize someone with that disease process to make sure that they have a wonderful experience. All right, let's go to the next slide. So right now, through the memory disorder clinics in the state and the Area Agency on Aging, we have 16 different DCCI task force. And a lot of those task force do educate a lot of different counties, just like ours is 2 counties, but overall there are 67 counties in our state. So you can really see we need a lot more DCCI task force just to manage the education across our state. So if you're ever interested in being a task force member for the local DCCI, just let myself know or Christine Didion through the Area Agency on Aging. And basically we meet once a month as an entire task force, but we do have subcommittees. So we really encourage each task force member to pick a subcommittee where they have a passion in serving, whether it's education or outreach or engagement, because that allows you to share your talents in that specific subcommittee of the task force with the community. One thing that we're really proud of this year is engagement. So what is engagement? We're trying to continue to engage the person living with the dementia and their caregiver in the community. So every month we have events just for that. Sometimes we have sponsors and sometimes maybe they may have to pay individually. But recently we had a sponsor for, I think there was 30, maybe 28 to 30 people that went to a Tampa Bay Rays game together. It was in a suite. It was free to them. They just had to pay for parking, show up, and they could enjoy that Rays game together. So it was people living with the disease as well as the caregivers. So there's just something like that to engage them, to continue to engage them in society. We have restaurant outings every month. We have bowling outings every month. We just do so much. And all these task force members join together to volunteer their time just to be there with them. Before I close, I did want to share another kind of mouth-dropping fact since we are in the middle of hurricane season. This is one of my passions, is about educating the community about hurricane and Alzheimer's disease. So if you'll go to the next slide. Did you know there are 12,000 residents in combined counties, Pasco and Pinellas, who have Alzheimer's disease and live in evacuation zone A? That means you have to evacuate when a hurricane is coming. What are we going to do with that amount of people? And that doesn't include their caregivers or their family members or their pets. These are just people that are diagnosed with Alzheimer's disease that are in evacuation zone A. So the Division of Emergency Management for Pinellas County is they have an excellent program. There's 3 shelters, special needs shelters in Pinellas County, and there's also one major one in Pasco County. And of course, Pinellas County, they'll open up more based on the need for what the impact is for the hurricane. So you basically have to register as a special needs resident for the hurricane shelter. But instead of, putting someone with Alzheimer's disease in the masses in this large, gymnasium where for a hurricane, that all that stimulation is going to agitate them and cause more behavioral problems. What they have done is with their staff is they have a room, whether it's in one of the high schools or the middle schools, they have a room classroom specifically just for 6 couples. That's going to be 12 people. They have a different shift, every 8-hour shift of nurses, a couple of nurses each shift that can help. They have activities for them, and I've encouraged them to make sure their meals are partaken in that specific classroom and not with the masses. And so they have gone above and beyond to use funding to make sure that they have whatever they can do to make that inconvenient moment in somebody's life with Alzheimer's disease during a hurricane, that it's going to be, a little bit easier for them. It's not where you can drop them off. No, you have to stay with your loved one that has Alzheimer's disease in that shelter. That's something wonderful that our emergency management team and their staff has provided for these counties, because they have the education about dementia. They know just how a hurricane, just trying to evacuate, how that can impact or exacerbate the disease process. So that's all I wanted to say about that. So the next slide. So these are some of the logos of the task force members that make up the Dementia Care and Cure Initiative. These are all volunteered, and it is an initiative for Pinellas and Pasco County. If you'd like to be a part of this task force, just a volunteer time, please let me know. You can see my telephone number and my email on the slide there at the bottom left-hand corner, and just contact me anytime, because we would love for you to help volunteer with us to make sure our community has the education that's needed. Thank you so much, Trudy.
Thank you, Celisa, so much for that important information and what the task force is doing. Great final note there about the emergency shelter. I wonder how many people have really thought that through, and to know that the county is taking the initiative to anticipate need and how to best manage folks with the dementia diagnosis, and how impactful an event like that would be on behaviors and such. So such a wonderful panel today, so much great information. I learned a ton, and I've been in this industry for 12 plus years. But I did want to say a final thank you to the panelists, to all of our attendees today. For veterans on the line, thank you for your service. We here at Empath Health are so proud to present these briefings every month to shine a light on what we do for veterans in the community, as well as our community partners. Next month, we are looking to dive into hospice and palliative care. For those of us that are caring for a loved one with dementia, end of life planning and support is an important part of the plan of care. And so we want to discuss some of the options with palliative and hospice care. So we'll be talking about that next month. So again, thank you to everybody for joining us today. This recording will be available within the next couple of days up on our website. And I believe Melissa had shared that link in the address. So we'll wrap it up. We're a few minutes over, so I appreciate everyone for your patience and for sticking it out to the end. And to our panelists again, thank you so much.
Thank you.
Thank you.